Planning is a dynamic process. It is an endless upward spiral of incremental efforts towards improvement. It consists of strategies from among alternative courses of action for every program. Now, planning is deciding in advance what to do, how to do it, when to do it, and who is to do it. Ano ba yung matututunan natin dito? First is to identify and discuss the steps in planning dental care for the patient, to identify the steps in planning dental for the community, and to identify the types of health planning and reasons why a planner should conduct a needs for assessment. Here are the contents. As a part of our role as health professionals, we are called on to assist health agencies and organizations in developing plans for obtaining dental care. We need to develop our own abilities to take our dental expertise and channel it into the areas of policy development, decision making, and program planning in a system more complex than the one with which we are familiar in the private dental clinic. This complex system may take the form of a community, an organization, a corporation, or an institution. The system can be better understood if we look on it as a patient possessing certain needs and characteristics because we are dealing with more than one individual. Planning a program for a community or institution requires a deep understanding and analysis of the system as a whole and of the individual members that make up the system. A basic definition of the term planning: a plan is a decision about a course of action. So in other words, a plan is a systematic approach to defining the problem, setting priorities, developing specific goals and objectives, and determining alternative strategies and a method of implementation. Uses of planning. Uses of planning is to match limited resources with many problems, to eliminate wasteful expenditure or duplication of expenditure, and to develop the best course of action to accomplish a defined objective. Now, coordination of efforts and activities aims to increase the availability, efficiency, productivity, effectiveness, and other aspects of activities and programs. There are several reasons why a planner should conduct a needs of assessment. The primary reason is to define the problem and to identify its extent and severity. Secondly, the assessment is used to obtain a profile of the community to ascertain the causes of the problem. This information helps in developing the appropriate goals and objectives in the problem solution. Assessing the community's needs, not only involving identifying existing health problems but also potential health problems and health promotion needs. What are the information needed for planning? First is socio-demographic population profile, the age, ethnicity, population mobility. Second one is the existing service provision. Dito na yung availability of services, range of treatment available, costs of care, access to service, and effectiveness of intervention. The third one is the disease level, epidemiological data, range of conditions, severity of disease distribution, and trends in disease. And lastly, public concerns. Dito na yung population priorities, view of health services, and demands of health services. Planning for the allocation of resources involves selecting the best alternative to achieve a desired goal when the amount of resources is very limited. No, yung mga planners kasi are called on to allocate the budget, the labor, and the facilities in a system so that it may meet existing needs and demands. So, example na lang is the decision by a local government natin with limited financial resources for the provision of dental services to cut services to medically indigent adults based sa cost effectiveness dun, sa pag-provide ng preventive dental care to younger population. So the planner needs to examine the types of resources available doon sa community. This includes the funds, the facilities, and the labor. So So first, funds. So ang question doon, what is the source of funding doon sa ating local level for dental care? Meron ba tayo third-party coverage available doon sa community? Is federal funding available through special eligibility programs? And lastly, if meron ba tayo private funds available through foundations or donations? To gather epidemiologic data on the patterns and distribution of dental disease, the planner can use a clinical examination, review the patient's dental records, or consult the DOH or Philippine Dental Association for data on a population residing in a similar geographic region with a similar characteristics. Steps in planning. First is to identify the problem, determining priorities, development of program goals, objectives, and activity, resource identification, identifying constraints, identify alternative strategies, develop implementation strategy, implementation, monitoring, and evaluation. Here, in identifying the problem, first we conduct needs of assessment. So first, we get the cause of the problem to identify its extent and severity of the problem. Then, after we identify its causes and severity of the problem, then we can obtain a profile of the community to ascertain the causes of the problem. So, this will help us in developing appropriate goals and objectives in the problem solution. And lastly, to evaluate effectiveness of a program. Next is information required are numbers of individuals, geographic distribution, rate of growth, population density and degree of urbanization, their ethnic background, diet nutritional level, standard of living, healthcare facilities available, public and private school system, general health profile, patterns and distribution of dental disease, history and current status of the dental disease, and fluoride content of water. Here in analysis of data, understanding their situation and needs of our target community, this will help us in the later steps to choose ano yung most relevant and effective way to achieve our goals. Now, why do we need analysis? So the purpose of this step is to build a common understanding about yung kanilang current situation and how it affects doon sa grupo or sa community. Then the deeper causes of the situation and their future situation na gusto nating ma-create for the success of the health program in the community. Now, analysis will make us aware of needs, demands, and opportunities. What is the community's demand and desire, and their strengths and weakness. After we identify the problem, we can proceed to determining priorities. Here, method of imposing people's values and judgment of what is important onto the raw data. When setting a priority for a community, the planner must ask how serious is the problem, what percent of the population is affected by it. Ano ba yung mga grupo that are commonly associated with high-risk dental need? Una-una dyan yung preschool and school-aged children, mentally or physically handicapped persons, chronically ill or medically compromised individual, mga elder people, expectant mothers, and also low-income minority groups. Next is development of program goals, objectives, and activities. So first is goal. A goal is defined as the ultimate desired state towards which objectives and resources are directed. They are not constrained by time or existing resources nor necessarily attainable. So ano ba yung goal talaga ng program planning ng dentistry? So the goal here is to achieve optimal oral health among Filipinos through education. This is prevention and dental health promotion. These provide assistance and programs for individuals who don't have access to dental care. Okay, here in objectives, we should specify the following: what, extent, who, where, and when. So what? So, dito yung nature of situation or condition to be attained. In extent, the scope and magnitude of the situation or condition to be attained. Who, the particular group, no? Sino yung mga group or portion of the environment in which attainment is desired. Where, the geographic areas of the program. And when, yung time which the desired situation or condition is intended to exist. Last is the activities. There are 3 components: what is going to be done, who will be doing it, and when will it be done. Okay. We have the goal, objectives, and activities na, so we proceed to the resource identification. So the term resource, no, it implies the manpower, money, material, skills, knowledge, and time needed or available for the performance or support of action directed towards specified objectives. So, ano yung mga criteria na gagamitin? First is appropriateness, which is the most suitable resources to get the job done. Next is adequacy, the extent or degree to which the resources would complete the job. Next is effectiveness, on how capable the resources are completing the job. Efficiency, the cost and amount of time expected to complete the job. And lastly, the resources. So, yung mga personnel, equipment, supplies, facilities, and financial resources.